This clip is sponsored by Med Travelers. If you're an SLP interested in travel therapy, visit medtravelers.com to get started. So when you're assessing, when somebody comes in, what are your preferred methods to assess them? Do you have specific equipment? Is it, walk us through kind of what that looks like.
Yeah. What's really interesting in voice is that some of our diagnoses are totally just like based on patient interview and what their symptoms are. And some diagnoses kind of show themselves through objective measurement. So we have acoustic and aerodynamic equipment that we'll use, and that has been pretty standardized across our practice. And recently, ATA put out like just an article in 2018 on the recommended objective measures of instrumental voice evaluation. And it tends to be what almost every voice center around the country uses in terms of the data. So if I were to look at someone's report from another voice center, I can basically understand the same objective information. It's like a pediatric therapist using the same test across setting. You can interpret the results just based on your own experience with it. So we do acoustic aerodynamic testing. We have some patient-reported outcome measures, maybe from graduate school. People might remember the Voice Handicap Index or other measures that help measure kind of the patient experience. And then, of course, with every patient, we take a look at the vocal folds with laryngoscopy, more specifically stroboscopy. I actually have the privilege as a voice therapist of not ever seeing a patient without seeing their larynx. Which is pretty specific because I know a lot of therapists are being asked to do voice therapy without ever knowing what's going on, right? Really common in our field is getting a report from a doctor that says patient vocal folds closing normal, needs voice therapy because they're dysphonic, but that doesn't tell you anything like why are they
Yeah.
having this dysphonia. That's really, really tough thing. So all of our patients get scoped in our practice, and if they did not come from our practice, then I will scope them. Something will happen where I get to see their vocal folds. Yeah.
And this is similar just to you have to forgive me. I've been out of grad school a long time, and my voice experience is very limited, but is that similar to just, it's just the camera that goes in your nose that they get, okay. So that's still the same. That
Still
hasn't
the same.
changed.
Hasn't changed.
Okay.
Yeah.
Okay. Well, and I had to have that done, and I was told they gave me grape flavored spray, but
Okay.
it did not help. It's
No,
very
it
uncomfortable.
also
It doesn't
tastes,
feel
the
good.
spray tastes terrible. Yeah.
Yes,
Yeah.
it does. I wish I would have gone without the spray, but
Yeah.
yeah, it was really interesting for me to see that for myself of like, oh, that's me. But yeah, that technology was just so cool, and it was how clear the visuals
Yeah.
were. I was
Yeah.
just so impressed.
Yeah.
So every single patient you want to see what is going on,
Correct.
regardless of okay. And that makes sense because you're right. They may say this is happening, and then you see, oh wow, well that's why, because
Right.
there's this giant
Right.
polyp or
Because, saying someone's voice is hoarse tells you nothing about how it is or isn't working other than it's
hmm
abnormal.
hmm
Um, it could be a polyp, it could be a paralysis, it could be just muscle tension, right? And so I am not in a profession that guesses. That's not what I do. I don't think that's what we do. And so I like not to. We're having the same conversation in terms of like dysphagia treatment, right? You can't treat what you don't know is happening. And
yes.
you can't target your treatment if you don't know what's happening. And
hmm
so we're trying to get a similar message across in terms of voice and voice disorders. I have a lot of therapists reaching out to me on social media or professionally. I have this patient, with this voice, what should I do? I don't know. I don't know how to help you.
Yeah.
I haven't seen their
I'm gonna need
throats,
some more information.
But
Yeah.
that's a really, really, really common thing in our field.